If you have ever been booked for an ultrasound scan, or if you have ever gone for an ultrasound scan, then you must have probably had one of these questions in mind. Hi, my name is Chinaza. I'm a medical sonographer, and today I'll be answering 9 most common questions asked by patients when they are booked for a scan or when they come for a scan. The first question, what clothes should I wear? There is no fixed outfit for an ultrasound scan. You wouldn't even be asked to change into a hospital gown, so you can wear whatever you feel like wearing. But if you want my professional advice or my professional opinion, ladies, please don't wear jumpsuits because you'll be asked to reveal your abdomen and you do not want to have to undress just because you want to do a scan. So preferably wear a trouser and a shirt or a skirt and a shirt. A gown will also do as long as you have something under it. The next question, do I need a doctor's referral for a scan? Most hospitals and most diagnostic centers requires doctor's referral, especially in advanced countries. If you have siblings or family members who are in diaspora, they actually make use of doctor's referral a lot. As a matter of fact, you can't even go for a scan without a doctor's referral. But here in my country, here in Nigeria, walk-ins are allowed. You can actually walk in for an ultrasound scan if you have a complaint, but preferably always have a doctor's referral so you have someone you can take the results to if there is a need for treatment. The next question, when can I see or hear my baby's heartbeat? I get this question a lot. Usually around 4 weeks, the only thing we see is a gestational sac. From 5.5 weeks to 6 weeks, we can see a yolk sac as well. I've mentioned 2 sacs. If you're confused, don't worry, I'll make a separate video about pregnancy ultrasound scans. That's one of the bulkiest scans we have. Then from 6 weeks, 6 days to 7 weeks, you can actually see a fetal pole. And the moment we see a fetal pole, we must see the heartbeats. The only reason where we don't see heartbeats is if the baby is no longer alive. But as long as your baby is alive, the moment you see a fetal pole, the moment you see a baby, that's what I'm referring to as the fetal pole, that's the medical term. The moment you see a fetal pole, we must see the heartbeats, not after. So that's usually around 6 weeks, 6 days, at most 7 weeks. The next question, why do I have to do another scan? Or why do I have to do a repeat scan? Usually, ultrasound scan is a routine one-time check for most persons, but for some ultrasound scans, you have to do a follow-up or a repeat scan, especially if you're doing a follicular tracking, for pregnancy scan, or if you have a pathology that was noticed that needs to be monitored, you will definitely need to do a follow-up scan or a repeat scan. The 5th question, can ultrasound detect ectopic pregnancy? The answer is yes. For an empty uterus for pregnancy above 5 weeks and a positive PT, that's an indication to look out for ectopic pregnancy. Like I said, I'll make a separate video talking about pregnancy scan because that's actually very, very bulky. But ultrasound can detect ectopic pregnancy. As a matter of fact, it helps detect it early to prevent a medical emergency. The 6th question, why am I just seeing black and white? I don't understand anything. One of the reasons is the ultrasound equipment. The ultrasound equipment can actually affect the image output or the visibility or what the image looks like on the screen. The second reason, personally, I don't expect you to stroll out of your house one morning and be able to interpret ultrasound images. We actually spent years to get to that point. So feel free to ask your sonographer to explain to you. And if the ultrasound equipment is clear enough, you'll be able to understand few images or few explanations. You'll be able to appreciate your baby's image better. You'll be able to appreciate your internal structures better when your sonographer is explaining. But on your own, it is impossible. Unless, of course, you are a doctor or a sonographer. On your own, it is impossible to understand ultrasound images. The next question, how long does the result take? Usually, ultrasound result does not take so long. It depends on how busy your sonographer is, but usually between few minutes to few hours. But most importantly, you will get the results that same day. unless there is any other reason why the results will not be able to be given to you. Number 8, can ultrasound detect my baby's gender accurately? The answer is yes. Ultrasound has the ability to detect your baby's gender accurately. It all depends on how far gone you are. Usually from 16 to 18 weeks above, your baby's gender is actually very visible. And it also depends on the position of your baby during the time of the scan. That actually plays a role. And then thirdly, it depends on the expertise of your sonographer. If your sonographer knows what they are doing, they should be able to tell you the gender. And if the baby's position is actually favorable, they should be able to tell you the gender. Then the last question, I'm sure you must have heard this, or you must have said the same thing at some point. My baby's gender changed. Can my baby's gender change? The answer is a big fat no. Your baby's gender cannot change while the baby's in the womb. If it seems like, or if you've heard situations where people said, they told me a different gender and I gave birth to a different gender, it simply means the sonographer made a mistake. Because while the baby is in the womb, the genitals and other organs are already formed, and there is no possible way for them to change along the line. So if you got a different gender from what your sonographer told you, it simply means your sonographer made a mistake, not that your baby's gender changed. Your baby's gender cannot change. These are the most common questions I have. And if you have any more questions, or if you want a part 2 of this video, feel free to drop it in the comment section. Don't forget to like, share, and subscribe. And I'll see you in my next video.